Introducing our biggest GMC Acadia ever. Offering bigger screens, bigger views, and even bigger journeys. Live your biggest life in the all-new GMC Acadia.
Hear that? Yeah, that's the sound of you relaxing, because now you're managing diabetes with the Freestyle Libre 3 system. You get to know your glucose levels and where it's headed. Manage your diabetes with more confidence with the Freestyle Libre 3 system. Ready to learn more about the #1 prescribed CGM in the U.S.? Visit freestylelibre.us to learn more. Based on retail sales data for patients' last filled prescription by manufacturer. Refer to the FLAIR NL4 study published in BMJ Open Diabetes Research and Care 2019. Safety info found at freestylelibre.us.
This episode is brought to you by Indeed. We're driven by the search for better, but when it comes to hiring, the best way to search for a candidate isn't to search at all. Don't search, match with Indeed. Use Indeed for scheduling, screening, and messaging so you can connect with candidates faster. Listeners of this show will get a $75 sponsored job credit to get your jobs more visibility at Indeed.com/SBO. Terms and conditions apply.
I was going to tell you a joke about dirt, but it's beneath us. What do you get when you cross a broken ice cream truck with impressionist art? Van Gogh.
If you just read the bio for Dr. Steve, host of Weird Medicine on Sirius XM 103 and made popular by two really comedy shows, Opie and Anthony and Ron and Fez, you would have thought that this guy was a bit of, a clown.
Why can't you give me the respect that I'm entitled to?
I've got diphtheria crushing my esophagus. I've got Ebola virus dripping from my nose. I've got the leprosy of the heart valves, exacerbating my incredible woes. I want to take my brain out and blast it with the wave, an ultrasonic, echographic, and a pulsating shave. I want a magic pill for all my ailments, the health equivalent of Citizen Kane. And if I don't get it now in a tablet, I think I'm doomed and I'll have to go insane. I want a requiem for my disease, so I'm paging Dr. Steve. Dr. Steve!
From the world-famous Cardiff Electric Network studios, it's Weird Medicine, the first and still only uncensored medical show in the history of broadcast radio, now a podcast. I'm Dr. Steve with my little pal, Dr. Scott, the traditional Chinese medical practitioner who gives me street cred. The weirdo alternative medicine assholes. Hello, Dr. Scott.
Hey, Dr. Steve.
And we also have a nice surprise. It's my wife, Tacie, now newly retired.
Hello, everybody.
Hello. This is a show for people who have never listened to a medical show on the radio or the internet. If you have a question you're embarrassed to take to your regular medical provider, if you can't find an answer anywhere else, give us a call at 347-766-4323. That's 347-POOHEAD. Follow us on Twitter at Weird Medicine or at DrScottWM, and visit our website at drsteve.com for podcast, medical news, and stuff you can buy. Most importantly, we are not your medical providers. Take everything you hear with a grain of salt. Don't act on anything you hear on this show without talking it over with your doctor, nurse practitioner, practical nurse, physician assistant, pharmacist, respiratory therapist, chiropractor, acupuncturist, yoga master, physical therapist, clinical laboratory scientist, retired drug rep, physical something, registered dietitian, or whatever. All right, very good. And don't forget stuff.drsteve.com. They must have accepted my explanation. I never heard another thing about it.
Cool.
So keep using stuff.drsteve.com, please. You can buy anything that we talk about on the show, most of the stuff that we've talked about, and or you can just click straight through to Amazon.com, which is, it's a great place to do your online shopping. And don't forget Dr. Scott's website at simplyherbals.net, simplyherbals.net. He's got some stuff there we'll talk about in a little bit. And then please check out our Patreon. It's patreon.com/weirdmedicine. It's just Tacie and me. We started this when Tacie was on the road with the idea that if we got to 1,000 subscribers, then she could retire from her job. And to hell, she just retired anyway.
I got retired.
Well, okay. Yeah. But anyway, would still like to have 1,000 subscribers. Hell, Carl at WATP's got like 7,000 subscribers over there. It's amazing. Is that right? That's not right. It's 1,500. But yeah, I'd like to have more subscribers than Carl does, but he really does have a pretty wonderful show over there. Yeah, he's a marketing genius. And they are doing a live show in Nashville in May, and your old buddy Dr. Steve will be there. So come say hello, and I'll buy you a beer. That's all you got to do. Just say hello.
I need to know the date of that.
Okay. So that you can
tell you can't
so that
go.
So that she doesn't go on vacation somewhere else while you're gone.
That's the only thing. Just don't go on vacation then, because you're staying with our 17-year-old. Actually, he'll be 18, but no, he'll still be 17.
It may be prom night.
Okay, that's good. Well, I'll be glad to be going.
Good. Get the hell out of here.
Anyway, and one of the things I want to do is take some people down to Prince's Hot Chicken, and then all the locals can laugh at us while we try to eat the stuff. And those boys from Rochester, like Vinny and Carl, are not used to that kind of stuff, so I'm going to definitely drag them down there if I can get them to go. All right.
Sounds good.
Check out Dr. Scott's website at simplyherbals.net, simplyherbals.net. Well, there you go.
Especially now, it's getting allergy season.
Yeah.
We're already seeing
so you actually have something.
That nasal sprays, baby.
Yeah. Tell them about it. It's not a plug. You're just telling them about something you're doing.
But, I'm kind of...
it's totally a plug.
It's totally not a plug at all. I love... I love our friends at Navage talking about how the importance of cleaning the sinuses out regularly, like you brush your teeth or wash your hands to help with hygiene. And
yeah, sure.
So we do. We have our.
So you're just stealing their idea.
No, hell, I had it first.
I mean, their marketing idea.
But totally stealing it.
Yeah.
Totally. Well, I'm
Fair
sharing.
enough.
I'm sharing it. But we have the two. We have the CBD and non-CBD oil containing nasal sprays that work extremely well to wash out that head. I've been wearing it out. There's already something blooming here, and I don't know what it is.
Yeah,
but it is wearing me out.
Mm-hmm.
Well, you go to Outback, it's the blooming onion.
I think I got the rheumatism.
Is that what you mean? I cannot find this thing, but we do have a voicemail from Tucker Dixon, and I do want to take it because we were supposed to do it last time. Now, Tucker Dixon does the recap on the Creep Off for Vinny and Carl, and he's a really good guy. And he had a question last week, and we didn't get to play it. And I just thought it was a good one just to stimulate some conversation. So, all right.
Hell.
Then we got to talk about...
Hey, Dr. Steve, it's Tucker. Just calling you and leaving a message from the Discord here, where my question was, with the rise of the celebrity doctor and the ease of getting into it through YouTube, TikTok, and everything else, what does the medical community think about these type of professionals going out there? I know there are some shysters out there like Dr. Phil and Dr. Oz who are pitching their green tea or red yeast or whatever color and random object they have to sell some kind of herbal supplements. But there are some where I think their heart is in the right place. So like what's spurring this question is Healthy Gamer GG. I think his heart was in the right place, but he was doing online therapy for streamers, which may not have been the best method. But I guess the crux of it is the medical community lagging behind and need to catch up, or are these new doctors who are trying to become celebrities at the same time, are they helping or hurting?
No, that's a great question. And Tacie. Hey, Tacie's here.
Hello.
Hello. Sorry, I skipped you in the introduction.
I don't care.
I was just going to
fun.
pretend that you just walked in, but actually I screwed up. So, this show started off as an homage to Dr. Dean Adele. Mm-hmm. Dr. Dean Adele used to do an hour-long syndicated medical show, And he kind of finagled it a little bit. He would have people call in, and then the producers would call them back and get the information so he could do some research, and then they'd call in the next day.
Okay.
And it would sound like they were calling live because he was always just on top of everything. And it was interesting when I found out how he was doing it. But the thing about his show was it was real medical. I never heard him say anything that I would say, oh, that's bullshit. Mm-hmm. And he stuck with the science and evidence and double-blind placebo-controlled studies and that kind of stuff. But he did some interesting things like throat nuggets and stuff. That's where I learned about throat nuggets. We've done that a bunch on this show.
Ooh, what's a throat nugget?
Well, it's a tonsillith, Tace. It's when people who are adults mostly have crypts in their tonsils and food and bacteria get caught in there. And the body will try to wall it off, and it makes these little sort of smelly plastic things. And when you open your mouth, you see these white dots in your tonsils if you still have them when you're an adult. And the trick is to get them out is to use a water pick. And so you water pick them out, and then you're done with them. But people will poke them out with like a tongue depressor. Mm-hmm. And then if you get them out of your mouth and then squish them, they smell to high heaven.
Yeah.
Because it's just old, yucky bacteria. But anyway,
yeah.
I learned some of that stuff from him. I was doing primary care, and I was learning things from this guy.
I always liked the guy.
I really respected him. And so when I told Steve Carlisi about the show, I said, I want to do Dr. Dean, but I want to do it in a more fun way. He couldn't have a lot of fun. Mm-hmm. And they would have to say, male genitalia instead of, cock or jungle area or whatever,
more medical terms.
They couldn't have any fun with it. Well, we can say, we can use real language that people use on this show, and he couldn't do that,
right?
Because it was syndicated on AM radio. Matter of fact, there were certain calls that were off limits, and so I said the thing to Steve was I want it to be completely uncensored, so if there's any question somebody asks, we can answer it no matter what language they use. And Tacie, you'll remember back in the beginning, our sort of thing was, I didn't want us dropping a bunch of F-bombs, but if the caller did, it was no big deal.
It was vile.
And you were sort of the enforcer on that when P.A. John would get out of line. I remember one time he made some joke about the Virgin Mary or something. I'm like, okay, that's P.A. John, everybody. And you looked at him and you were like, what the fuck are you doing? So
he was pretty good at provoking.
No, he was. He was funny. He was my funny friend back then,
awesome.
So that's why he was on here. And he had the orthopedic experience that I don't have.
Yeah.
So he brought a lot to the show. But but that was the original intent. Of course, since then I've dropped more F-bombs than can be possibly
I think the
counted.
show has calmed down a lot, Steve.
It has calmed down.
Oh yeah, totally.
We're less shock jockery. There's less shock jockery than there was back then. But I'm still, so I don't care to drop an F-bomb now because I'm not worried about some of the other content
Not
that we're
worried
throwing
about
out there.
ever making any money off of it or anything like that.
That's true, too.
We gave up on that idea a long time ago.
We certainly did. But after the first one, you and P.A. Jill and I and P.A. John went outside of the studio on West 57th and looked up at the Parker Meridian, and we were thinking, now, should we get a condo here? Or should it be, it's like, Jesus. Because, we knew how much money O&A were making. We figured we'd make a fifth of that, which we would have been fine with. I could have quit my job if we'd made a fifth of what they were making.
Oh my gosh!
Yeah.
Well,
isn't that wild?
Yeah.
It was a fifth of $100, right?
Something like that.
Something like that.
We yeah. So you know what though? So back to Tucker's point, not making money off of this show and just doing it for the joy of doing it has made things easier for us to not fall into what he's talking about, because. Dr. Oz is a great example. Mehmet Oz is a real physician. Mm-hmm. He was highly regarded in his field. And then he gets hooked up with Oprah. And now eventually, and he was still reasonably well respected. He was doing more like the kind of things that we do. He'd come on and talk about some topic. Then he gets his own show, and he's making millions of dollars, has millions of viewers, and now he's got to come up with something every week. Yeah. Every single week he's got to come up with something.
Oh, every day. Isn't he a daily show?
I'm sorry. Yes, but week after week.
He has a team of writers.
Sure, but you can just talk about what's best for your sinuses just so many times that people get tired of it.
Yeah, sure.
And so now I see that he's crept into things like red yeast rice, and there's some evidence there, but some of the stuff that he has promoted on his show is just frankly malarkey. But he's run out of things, and that's what people are interested in is malarkey. Mm-hmm. And so then when you get into that phase of it, yes, the medical profession has some things to say about it, and there are some people who have, in the medical profession that have called him out on this stuff. And we have here ourselves from time to time when he said some silly things. And, Dr. Drew catches some hell with the rehab, particularly celebrity rehab, where at times, and I don't know what's in his mind, it looks like there's some exploitation going on. Now, there's no question that he has increased the discussion about rehab and increased knowledge about rehab, but at the same time, you got to have a show every time. And if you're going to which celebrities are we going to get this time?
Yeah,
and we got to ramp it up, and it's got to be more interesting this time than last time. So we need to show somebody really decompensating or whatever. And so the medical profession does have some issues with those kinds of things as well.
A show he does not have trouble with is Botched. When Steve watches Botched with me, I don't know if you've seen that, Scott. It's where people get plastic surgery to the point where they just need lots of help to undo it.
So it's just gone poorly?
Yes.
Okay.
With those two doctors, Steve will actually watch and not yell at the television.
No, that is true.
Now,
that is true.
Most of the other shows?
Most of the times they're fixing big, giant breast implants.
That could be why he's not yelling as well.
Yes. He's like, how do I get into that?
I know. No, I like those guys. They help people.
Yeah.
Well, and the yelling should be at the people that did the surgeries to get the folks to that point.
That's right. But I do like that. But that Dr. Pimple Popper, I'm just yelling at the TV the whole time.
She's the best. What's wrong with her?
She's not.
Oh, she's the best by far.
Okay.
Oh, by far.
Agree to disagree.
Well, maybe disagreeing on the wrong thing, my friend.
Oh, okay. No, in that regard. You get a TV show.
You can just watch her and turn the volume off, and it's a great show.
Okay, well, if you want to be, okay, Harvey. So it's 2022, but I'm not I
didn't say why.
And it's just from time to time I see some of the techniques or not, anyway, I don't know. So, people in the medical profession have some issues with celebrity doctors. There's no question about that. That's why I'm not a celebrity. And I know there are some people are made fun of because they say, well, I don't have a big audience, but I want it that way. And you all know who I'm talking about. There's multiple people that talk that way. We're in a different situation. I've got a real job. And so Tacie and I decided a long time ago that if I was going to do this, and now we're doing it, that we didn't want to put ourselves in a position where we could lose the actual job where we're making money. Mm-hmm. And so, I turned down a TV deal because I'd have to take 12 weeks off, and it was for no money.
Oh.
And they said, well, you'll make money if it's a success. It's like, I can't jeopardize my family that way.
No.
And Bobby Kelly talked me through that one. He said, look, dude, it's going to be for no money the first season, and you only make money if it's like a huge hit. And, it's like I knew it wasn't going to be a huge hit, even if he or some other people that we had that talked to were my co-hosts, I didn't have the confidence to just put everything on the line for that. And so I like just talking to who we talk to. We've had the same 15,000 people downloading our podcast for the last X number of decades now, and I'm happy with that.
Yep.
I love our audience. The one thing I've noticed is I've seen people posting in our subreddit, and they're like, well, this isn't a double-blind, placebo-controlled study. Now, maybe they knew that before, but I like to think that they got some of this critical thinking when it comes to medical information from our show.
Yep.
And I know our audience is very sophisticated when it comes to medical knowledge, and some of that is just because that's, we've disguised an actual medical show as light comedy, So anyway, all right.
Right. That's cool.
What were we talking? Oh, Tucker Dixon's question. So, yeah, that's the thing. What do you think about some of those TV doctors, Tace? What is this?
Oh,
okay. Never mind.
I don't really have an opinion. I don't necessarily like to watch them.
Yeah.
I do like Botched. Botched is pretty
Botched is
entertaining.
awesome.
Yeah, it's
those
pretty
guys
good.
are really, really good at what they do.
Yeah.
I
they're
appreciate
the plastic surgeons?
Yes.
I think I've seen 1 or 2 episodes of that.
I appreciate virtuosity wherever I see it, and they are virtuosos. So.
Yeah, I don't really watch them. I don't like to watch Dr. Pimple Popper. When she first came out, I was fascinated by it, but that lasted a couple of days.
Yeah.
And then
it says, how many lumps can you see somebody remove?
Yeah, and
how many sebaceous cysts can you see somebody use an odd approach to?
now she does help people with those big.
Yeah.
I mean, she helps a lot of patients.
Yeah, no question about that.
But yeah, that's just not my thing.
Yeah, okay. I can't find this phone call, so I'm hoping the guy will just email it to me. But it was good. It was. I'll just tell you what it was, and then we've got some articles to do, and then we'll take some regular phone calls, and then we'll hit the waiting room and see if they've got anything.
We got a couple, yeah.
This guy called in and he said if I get alcohol on my finger, it will burn, and I blow on it and it gets better. But when my hands are cold, I'll blow on them and they get warmer. Now, how does the body know which one to do? And the answer to that is that, and I'm sorry, dude, if I butchered your question, that when you get alcohol on a cut and you blow on it, you're not actually changing you are changing the temperature. You're actually making it colder. But that's because the alcohol is volatile, and when you blow on it, you're increasing its evaporation away from the wound. And when you finally get it to all evaporate away, the pain goes away because the alcohol isn't irritating the wound anymore. That's different. And then your breath is always going to be warmer than the ambient temperature if you're out in a, sub-zero weather. And so there's really no disconnect there. It's just two different phenomena. So anyway, it's kind of a cool question. I wish I could have found it.
Good question.
All right. What do you got, Dr. Scott?
Well, I've got two pretty good stories.
Okay.
The one you sent me, it's the first ever recording of a dying human brain.
Yeah, I saw this.
Shows brainwaves similar to those with memory flashbacks. And the gist of this
How
is,
do they get that, though?
Well, yeah, it's kind of interesting.
Can you get closer to your mic?
Yes, sir.
Sorry.
It was kind of a sad story in a way that they had an 87-year-old gentleman that had recently begun having epileptic seizures, and they had got him in to do some testing on him. They're going to do an EEG on him.
Yep.
Hooked up his brain. Once they started running this essay on him, the poor guy has a big heart attack and dies.
Oh my goodness!
So they left the EEG running on him and evaluated.
What?
Yep, they evaluated the.
Did they code him?
They coded him.
They did code him.
Yeah, but ran the EEG on him as he was dying, and as they were
Well, you
trying to
can't
save
just
his
rip
life.
those off. So
No.
for one thing, he's
And
talking
they
about
take forever to get on.
he's talking about a brainwave test, And those things are basically glued onto your scalp, so it's not like you can just rip them off. So you might as well leave them on.
Yeah, because it would take a while to.
But it was just an EEG, though.
Yeah, yep. Just a normally they're just.
Well, I don't see how they could see anything with that. But go ahead, and tell us.
Well, they say that actually what they found was that as he was dying, his brain started showing some strange oscillations, which you would see when someone is going into a deep meditative state or dream state. Which is kind of
I want to see this.
Yep. And
I'm always very suspect with medical journalism because they get stuff wrong all the time.
Well, even worse. I want
to see the publication.
Going back to a discussion we had a little while ago, remember we were talking, it's been shows ago, we were talking about how in medicine you guys have been able to, you've changed the definition of death.
Yes.
Kind of with each.
Right.
Not century, but with each.
Well, no, with each new technology.
Yeah,
so
onset of new
we defined
technology,
it as stopping breathing. Then we got the ventilators.
Mm-hmm.
We just defined it as the heart stopped beating. Then we developed CPR, and now our thing is absence of brain activity.
Mm-hmm.
Go ahead.
Yeah, and that's kind of what they're saying now. They're saying that this might change how we look at death even further, just because now, just because they're technically dead. Per today's standards, they're still having some kind of brain activity, which and it's kind of an interesting article. It's actually really kind of fascinating because these doctors talk about not only how you die and how it correlates to some of those dream states, but if you look at more the spiritual and metaphysical side of things, you can really kind of say, what is it that you're seeing when you die? Are you having these flashbacks? Are you?
My
seeing
brother
yourself
has a theory about this.
Yeah, I'd love to hear it because.
Well, his theory is that, and there's some science fiction people have talked about this as well, that when he dies, he thinks that his brain's going to go into a state where it will, all like a hologram, all of the information will be there, and you can work your way through it, like Billy Pilgrim in Slaughterhouse-Five, where he would live different parts of his life at different times. He became unstuck in time. And my brother thinks that state will allow you to experience that basically forever, even though that the chemical activity in your brain will stop, because to you it will seem like an eternity. So that's kind of interesting. Of course, my brother's a weirdo.
Yeah,
so.
yeah. Well, but and if you think about
his favorite thing to do is when he meets somebody new is fart. And then laugh about it because it smells so bad.
Oh, for God's sakes.
That's a true story. You remember that, Tace? Smartest. You don't remember?
No.
The first time you met my brother and he basically shit his pants?
No.
And you smelled the smell because they're always silent. And okay, I can't believe you can't remember this.
That's
and then
hilarious.
He thought it was the funniest thing because you were like, what the hell is that smell? And it's like, I smelled that my whole life. I know that the smell of his horrible bowel gas, because he was older than me and he'd hold me down and then just fart in my face, and it was so foul.
Oh, God.
There's something weird living in his colon. And we were in Canada once, and he passed gas in the cabin, and 5 adults and one 15-year-old went running out of that cabin as fast as we could get out of there because it smelled so bad. Because if you didn't, you were going to puke. Well, anyway. Okay. Anyway, so go on.
May I ask you, yeah. Well, no, that was pretty much the end of the paper. It was a really short paper. Did your brother come up with this hypothesis after your dad? Kind of.
And I don't know. I mean, he told me about it during the eclipse. I remember that. It was like fun conversation during the eclipse.
Well, it was cloudy.
Yeah.
There wasn't much to look at.
Oh, that pissed me off so bad. It was going right over his house. So we had a place to go.
Mm-hmm.
And it was the first total eclipse I was ever going to see. And I've been wanting to see. I've seen a ton of partial eclipses. I made the little pinhole box things back in the 60s and all this stuff, and we're going to finally see one. And it wasn't too bad. It was just a little bit cloudy, which I could deal with. I got some pictures of before the total eclipse. And then we walked up to this field where we would have an unobstructed view of the sun. And because the temperature changes, if you've got any precipitation or anything, it's just going to precipitate. And so as the sun started to glide itself and you could see the shadow of the umbra coming toward you, then the sky over our heads just went completely dense with clouds.
No, rat farts.
I was so pissed.
Rat farts.
So pissed.
Then it took us 8 hours to get home.
And then it literally took us 8 hours to drive 2.5 hours because there were so many people that had congregated along the path of the eclipse. God damn it. Anyway.
That is hilarious.
So, go.
So, how about another one?
Yep.
I found them really cool. And this, again, going back a couple of shows, I don't remember exactly what started the conversation, but we're talking about births. And folks, you know, we talked about post birth and and how some of the Chinese people would eat the placenta. And that got me into doing a little bit of research.
It's not just Chinese people.
No, it's not just Chinese, but I can only speak to Chinese.
Yeah, a lot of Americans will do that as well.
I think Tacie probably did.
No, Tacie didn't do that.
Fried it up in an egg with little
Ooh, I remember seeing it, though.
It
It was pretty gross looking.
Yeah, it's like an alien.
Ooh.
It's got all the veins and stuff on the one side, and it's all meaty on the other side.
Ooh.
My dog had 10 puppies and ate all 10 placentas.
Well, there you go.
Yeah.
Got the nutrients back.
Yeah, exactly.
Which one?
Sadie. You didn't know this one.
I was gonna say,
And then she didn't leave the whelping box for 2 days. And then when I finally got her to go out, she took the most gigantic dump I've ever seen a dog ever take. Because she had to shit out 10 placentas.
Oh, I bet. Yeah, Lord.
Disgusting.
I bet that was disgusting. Wasn't it?
She was a good mom, though. But anyway, go ahead.
Oh, my gosh. Okay, so a couple of these they're called strange birthing trends that came.
Ooh, I'm going to like this.
Have come into the forefront here as of late. Lotus births.
Okay, what's
you want to
this?
guess? You want to guess? Lotus birth.
Lotus birth. Well, are you just in the lotus position? I don't know.
Well, that's what I was thinking. You're born in, or you're sitting in lotus position and dump them into a bath
bucket
of water or something. Hey, we're boys. We don't know any better, Tacie. A lotus birth. So this is when because typically when a baby's born, the umbilical cord is snipped pretty quickly, right?
Yeah.
Dr. Steve, you've delivered quite a few.
Yep.
However, what this lotus birth is about the parents allowing the cord to remain attached to the placenta until it breaks normally.
Okay.
Or naturally. Now,
what?
Yeah, and that's
how long does that take?
Well, it takes days, possibly weeks.
Even dogs don't do that.
Exactly, they chew them off. So they're saying that is not a great thing to do. It's just really easy to spread some because the placenta is technically dead tissue.
Yeah,
so
at that point.
It's going to become necrotic.
You mean so the woman delivers the placenta, and then they just walk around with placenta?
I guess they wrap it up in a little burrito kind of thing and carry it around. No, it doesn't say that, but there's they just allow it to slough off naturally. A lotus birth.
No.
Yep. All right, now I'm just getting started.
That's disgusting.
Now listen, sometimes you will leave you won't cut the cord if the kid, for whatever reason, is anemic, and then what you'll do is hold the kid down below the woman while the placenta is still hooked up. This is right when they're born, before the placenta starts to get disconnect. And then what you're trying to do is get as much blood to go from the mother's side to the baby's side before you cut it. Mm-hmm. But we're talking like 5-10 minutes. Mm-hmm.
Yeah.
If that.
Yeah, not 2 days or 3 days.
Why would people do that?
I don't know, Dr. Steve.
If anybody has done this, call in.
Yeah, let us know.
347-766-4323. I want to hear about that.
All right, number 2. Ready for this?
Because it's not natural. I don't even think our caveman ancestors did that stupid shit.
No, they whacked it off with a big rock. and then ate the placenta.
Chewed it and ate it. You know they ate it.
And they fried it up. They fried up some quail eggs and a little bit of salt and
I'm
pepper.
talking cave people. I don't know if they ate quail eggs.
Oh, yeah.
Oh, maybe they did.
Yeah, just have some kind of
ate them raw.
A cave chef, yeah. A free birth.
Okay.
Okay, you want to guess the free birth?
I'm guessing you have Medicaid. Is that it? That's not it.
You're exactly wrong, Dr. Steve. Congratulations. Okay. We need a boo for that one.
Okay, I'll give myself one.
All right, here we go. So a free birth is an unassisted birth where the woman chooses to have the birth without any medical help of any kind.
Okay.
Which is okay as long as there's no complications. But it reminds. Listen, this is a true story. I read this on in the newspaper, and it was not here locally, thankfully, but evidently this gal was going into a labor and tells her husband this, and he wanted to do a couple other things around the house, and finally, when he got around to driving her to the emergency department, she starts having the baby
in the car.
But here's where it gets really cool.
Okay.
So this gal, as they pull up to the emergency room, says the baby is coming out now because it's like her second or third birth.
Yeah.
Not uncommon.
Yeah.
The guy starts panicking, freaking out. So he parks the car, and he's got cars like we have with the keys that you don't have an ignition.
Yeah.
So he goes running out to the emergency room, and the car automatically locks. She rolls her chair back to start having this baby. She's in active labor. Well, they come out. The guy gets back to the car, and he's so upset he faints. The emergency department can't get into the car. Now, this is a true story. Can't get into the car. Finally, as she delivers the baby, she can reach up and unlock the car door.
Oh, God.
No, this is a true story. They wind up having a wheelchair to wheel her in. She's like, no, you better take him in. So she walks in the emergency room
with the baby.
And they have to roll his ass in there in a wheelchair.
They might as well just turn around and go home.
Oh, God bless him. All right, one more.
That guy won't.
No,
he'll
never live that down.
No.
She'll give him a bunch of grief. Let's hope. All right, one more. And then
wait, how many is there? Because you could do some more of these.
Okay, yeah, there's 11 total.
Okay, well,
some of them are good, some of them aren't so good.
Okay, give us another good one.
I'm gonna give you a good one. This is a good one. I cannot wait to see Tacie's response to this, since she's the one of only 3 of us that have had children in this office. Okay, so. Let's see. The orgasmic birth.
Oh, yeah.
Woohoo!
I had some. Remember, Steve?
Yeah.
An orgasmic birth.
Oh, yeah.
That's bullshit.
You want to guess? I say you want to guess at what that means?
I mean, I'm assuming that...
Are they stimulating a part of her body while she's in labor?
Well,
because nipple stimulation is something. We do that to to release... oxytocin, so that you can increase labor if you need to, and sometimes nipple stimulation by itself will do it.
And it'll
But
dilate.
If this is clitoral stimulation during birth, I can't imagine too many women who've been through the birthing process would be okay with this.
I mean, who would be interested in it?
Well, they
okay. Tell us about it.
So now, according to this 2013 study, 0.3% of births. These women have orgasms.
Get the hell out of here.
And experience some sexual feelings during the childbirth, and they do.
Wow, that is very interesting. Please tell me more.
And it doesn't say they were being stimulated externally. I guess it's just from the fact of
from the birth,
evidently. So I don't know. Tacie, you'll have to wax poetic.
Oh my God! Can you imagine? Now listen.
I would have hit or kicked. I can't have, no, it's anything but that.
Yep.
And for anybody that I know who's
from then on too
had a baby would agree with me. There's nothing sexual about it. As a matter of fact.
Well, of course, you can have an orgasm without being sexual. Like there are women that have, if they
cross their legs,
jump up and down, they can have orgasms and stuff like during calisthenics or during aerobic exercise. Women who have orgasms when they're riding a bike and stuff like that. So you can have an orgasm without being engaged in sexual activity. I just can't imagine you would have an orgasm during
this. Having a baby.
Right. Agreed.
Yeah, it's completely. So
Tacie's calling bullshit on this.
Yeah, I'm having a hard time believing it.
Now, okay, so if you've ever had a baby and you have had an orgasm while you were delivering the baby,
please call
us. And not you, Tacie.
Yeah, we know he's on this. All right, one more.
Okay,
you're gonna love this. Pregnancy suits for dads. for dads who want to get in on the action.
Oh, come on. No.
They have
no.
a
I know what this is.
They have a mommy tummy pregnancy suit designed to complete with the heaviness, the kicking, the movement of the baby, and the guy can wear it around and enjoy this experience.
Oh,
Here's the thing. Just like all of these other things, he can take it off.
Yep.
The woman can't.
Exactly.
So it's bullshit, and it's virtue signaling, sort of, and it's not empathetic. You're not experiencing what she's experiencing. It's bullshit, in my opinion. This is my opinion. And the difference, again, being you can just take it off whenever you want to.
Mm-hmm.
And you're not facing labor. Talk to Tacie about labor.
No, thank you. I'm sure it was a lot of things.
We were eating.
Pleasant wasn't one of them.
They were going to induce her
Okay.
on Wednesday, but Tuesday night we were out eating, and she looked at me and she said, "My back hurts," and I'm like, "You're in labor." You want to talk about it?
Well, I mean,
every woman who's had one knows this story. But
yeah.
A lot of guys don't know it.
We went home. There were a lot of things that had to be done before we could go to the hospital. The dogs had to go to the kennel.
Was this number 1 or number 2?
This was number 1.
Yeah.
And it was very foggy on the way home, on the way to the hospital. And Steve goes, "Let's name him Foggy. Let's name him Foggy." And I hit him.
She just went, "Oh!" It's like, okay, jokes, not a good time. Not a good time for jokes.
Yeah.
I was trying to lighten the mood a little bit, but Tacie, I'd never seen her like this. I mean, she was leaning her head against me, pushing as hard as she could when I was sitting there because she was in so much pain.
It was terrible.
And then the anesthesiologist didn't come, and he didn't come. And he's like, "Well, we have to wait for Dr. whatever his name was to show up and write the order." And so I picked up the phone and I called. That was the one when I called him, right? I said, "Will you please put in an order for an epidural for my wife, like right now?" And because I was going to put the order in my damn self. I have privileges in that hospital. I could do that. Would probably be a problem later, but I'd rather be in Dutch with administration than with her.
Than the boss, that's right. Yeah, you and me
because
both.
it was hours he never responded.
Yeah, he wasn't responding to his pages, and but I had his number. So anyway, finally, what was you remember his name? Say his name.
I don't remember his name.
Oh, you don't remember Stan's name?
Oh, Stan. Yeah, Stan the man.
Yeah.
I remember Stan the man. I don't remember the guy who delivered us.
I knew you would remember Stan's name.
Yeah. Oh, God, Stan.
She loved Stan.
I do
because
love me some Stan.
He came in and did an epidural, and he's like, "I don't know if I got it in the right place." And I saw Tacie sitting up talking on her cell phone. I said, "No, you got it in the right place." Yeah. And from then on,
And he helped with the second one, too.
Yeah, he did.
Oh, God, what a wonderful, wonderful person.
Yeah. Yeah, good old Stan. Anyway.
That's cool.
All right. What are we doing now? What do you want to do? Answer some phone calls?
Let's do some phone calls.
Okay.
Number one thing, don't take advice from some asshole on the radio.
Do we have any questions from the waiting room?
We had one a little way.
Why don't you gather
I'll
those?
Go back, yeah,
you missed a bunch of them last week. I'm just gonna say. I'm not fussing at you. I'm just saying. I went back and looked. So, what we need to do is is have people put question in capitals so that Scott can see it a little bit easier because there's a lot flashing by, and if we don't see it, ask it again. Because he's got a lot going on too.
Yeah, and I'm trying to keep notes and
yeah. No, dude,
hey,
not fussing at you. I'm just saying
a solution. We're looking for a solution.
Yeah,
Dr.
that's
Steve.
right. Thank you. All right.
Today's episode is brought to you by Angie. Angie has made it easier than ever to connect with skilled professionals to get all your jobs and projects done well. Let me tell you, there's the version of it where you try to do something at home, and then there's a version of it where you have someone help you, you watch them do it the right way, and you go, thank God I didn't try to do that myself. I have fully done things around the home that I think look good, and then a bang in the night, and I wake up to a shelf collapsing, a painting falling off the wall. I've seen it all go south. I own a home, and I can tell you, I know how much work it can take. Whether it's everyday maintenance and repairs or making dream projects a reality, it can be hard just to know where to start. But now all you need to do is Angie that and find a skilled local pro who will deliver the quality and expertise you need. Whatever your home project, big or small, indoor or outdoor, you can Angie that and connect with skilled professionals to get the project done well. Right now, one of my wish lists is I want a bike for my condo in Milwaukee, and I would love to rig it up on a pulley in the ceiling because I have one of those like lofted ceilings, but I'm so scared to try that on my own. Angie has 20 years of home experience, and they've combined it with new tools to simplify the whole process. Bring them your project online or with the Angie app. Answer a few questions and Angie can handle the rest from start to finish, or help you compare quotes from multiple pros and connect instantly, which means you can take care of any home project in just a few taps. Because when it comes to getting the most out of your home, you can do this when you Angie that. Download the free Angie mobile app today or visit Angie.com. That's ANGI.com.
This episode is brought to you by Indeed. We're driven by the search for better, but when it comes to hiring, the best way to search for a candidate isn't to search at all. Don't search, match with Indeed. Use Indeed for scheduling, screening, and messaging so you can connect with candidates faster. Listeners of this show will get a $75 sponsored job credit to get your jobs more visibility at Indeed.com/SBO. Terms and conditions apply.
This podcast is supported by Progressive, a leader in RV insurance. RVs are for sharing adventures with family, friends, and even your pets. So if you bring your cats and dogs along for the ride, you'll want Progressive RV insurance. They protect your cats and dogs like family by offering up to $1,000 in optional coverage for vet bills in case of an RV accident, making it a great companion for the responsible pet owner who loves to travel. See Progressive's other benefits and more when you quote RV insurance at Progressive.com today. Progressive Casualty Insurance Company and Affiliates. Pet injury is an additional coverage and subject to policy terms.
Steve, my name is Paul. I'm calling from California.
Hey, Tom.
About 3 weeks ago, I had COVID. The first night of getting COVID, I experienced electrical shocks shooting through my brain throughout the evening. I have no idea what that was. I'm hoping you do. I can't find anything online about it. Please let me know. Thank you, Doctor.
Yeah, Google brain zaps. That's what that was. And I had it when I was withdrawing from Cymbalta.
Yes, that's what I was getting ready to ask you, if that's the same kind of brain zaps.
Yep, I think
Those
so.
are miserable.
COVID caused a lot of neurologic issues, and every once in a while you get somebody with brain zaps and stuff like that. You know, it's just a weird.
Where are they? Are they all over? Just one?
No, in your
spot?
brain.
Well, no, I know, but
it goes like from one side to the other, like electricity going through your brain. It's basically a neuropathic, syndrome.
Not like a migraine headache.
No.
Okay.
And
gotcha.
It's probably an illusion. It's
Right.
not really going from one side of your brain to the other. It just feels like it is.
And that's the only way to describe it, is a zap.
Yep.
Mm-hmm.
I had brain zaps.
That's terrible.
And Terminator eyes. I've told you about that, right?
Yep.
You know, it would say, and people say, well, Terminator eyes, what the hell are you talking about? It's like whenever you would see those, the Terminator in their full sort of Terminator aspect, not when they had the human disguise on, and they would all of a sudden be making these machine noises, and you would, when their eyes would move, they go, and that mine were doing that. Every time I moved my eyes from side to side, I would hear that in my head for about 2 weeks. And I've had other people, since I said that, email me and say that they experienced it as well. So, that's what it was. It was a neurologic manifestation of your body's immune response to COVID-19, and be thankful that's all it was. And it went away. It sounds like it went away. All right, but it's a legit symptom. All right.
Hey, Doc, this is Zach from Oklahoma.
Hey, Zach.
My question is, I was just wondering if it was possible to get different viruses at the same time.
Good question.
If you're not feeling well and go to the doctor and get tested, like could you have like COVID and the flu and strep throat all at the same time? And if you do, what happens in your body? Do they like fight each other over dominance?
Yeah.
Do they get along or what? And
finish him.
Thank you for that, and I appreciate you taking.
That's a great damn question.
That's a fabulous question.
So when you have a virus, most people have noticed that they get one virus at a time. Most of the time they're working their way through the community. It really is just maybe one dominant virus working its way through the community at the time because of transmission, right? But one of the hypotheses is that when you have a virus, you produce these cytokines called interferons. And interferons help to prevent further infection from viruses. And at least that's one hypothesis. And so when you have one virus, it's unlikely that you're going to get another one. But I will say that I saw one patient during this 2-year and some pandemic that had a positive COVID test at the same time they had a positive influenza test. And I'm also going to say that was the only influenza I've seen in the last 2 years.
Right on,
was
yeah.
in that person that was infected with both viruses at the same time.
Yep.
So it can happen.
Mm-hmm.
Now, strep throat that's not a virus, that's a bacteria. It's called by group A strep, streptococcus, and it's a bacteria. You treat it with antibiotics. So, by the way, we don't treat strep throat with antibiotics because we want the strep throat to go away.
Mm-hmm.
We treat strep throat with antibiotics to prevent rheumatic
fever.
Yeah, rheumatic complications. Untreated strep is the cause for rheumatic heart disease and other things like that. So
bad for your ticker.
Yep. All right.
All right.
I got a feet thing. Might be for you, Dr. Scott.
Cool. I'm ready.
All right.
Hey, Dr. Steve, Dr. Scott, Tacie.
Hey, man.
This is Mike in Pennsylvania. How are you guys doing?
Good. How are you?
Good. So I'm having a problem with my feet. The big toe and both feet are always cold. Sometimes they feel kind of numb, and they look white when it gets bad compared to the other toes on my feet. So even at room temperature, I need to wear slippers or a sock, or they feel uncomfortable regardless of the position that I'm in. The weird part is that if I'm walking or running, even if it's cold outside, they feel a lot better. So, I Googled it, and a lot of it says maybe I have diabetes. I don't think that's the case.
I don't think so.
But what could be causing this problem? And I actually made an appointment with a podiatrist, which leads to the second part of my question is, why do podiatrists need their own separate schools? I kind of understand why dentists do, but if a hand specialist or a knee specialist is just an orthopedic surgeon who went to medical school and then specialized in one of those fields, why aren't the feet the same thing?
It's a great question. We should get a podiatrist in here to answer that. That goes back way, way, way back. That the School of Podiatry is separate. They go through a full curriculum, and then they are basically surgeons of the feet. And some orthopedists do foot surgery, but a lot of times they'll refer to a podiatrist depending on what it is. And they'll do toenails and stuff that the orthopedists won't do, so they do more comprehensive treatment for the feet. Go to an orthopedist with a big toenail that's full of fungus and see what they tell you.
They're going to say, why the hell are you here?
You get nothing. You lose. Good day, sir.
That's basically what they're going to say to you. So, but a podiatrist will say, come on in, we'll take care of it. So that's partial answer to that question. Now, on to the white feet, or the white big toes that feel better when he's exercising. What do you think, Dr. Scott? I've got an answer.
Maybe Raynaud's.
Okay.
Maybe. Maybe.
I'm not too thrilled with that answer.
It would be strange for it just to be in that one toe. He could have a diabetic neuropathy.
Well, he said he doesn't think he has diabetes, so that's the thing. So everything in Google says this is a manifestation of diabetes, but he doesn't have diabetes.
No.
So let's just assume he doesn't have it, because most people who have it know it.
Yeah.
And it's so easy to diagnose, that is, assuming he goes to a primary care from time to time, they would have picked it up. So I'm thinking, this is just me, it's just both big toes, and they're white, and then when he runs, it gets better. So it's obviously circulation.
Vascular, sure.
But what's causing it?
Yep.
And because when he's running, he gets more blood pumped there. I think he needs to look at his shoes.
Yeah.
I agree.
Thank you, Tacie. Wow, That's a first.
Well,
oh, my God.
I've had shoes before.
I believe hell just froze over there, Dr. Scott.
I've had shoes before that made my toes feel numb. And I take them off and put different shoes on, and they go back to normal.
Yeah, and they may feel worse for a while after you take the shoes off.
Yep. Well, and too, if he does have that, if that theory's right, he may have a really like a big bunion, hammer toe kind of thing.
He may.
That's just it's pinching and trapping his
that
blood
could
vessels,
be.
which
Yeah.
would make sense too. Gout.
But I see people buy the wrong shoes, and they feel okay when you're wearing them, but you don't realize what they're doing to your feet.
Yep.
So where would he go?
To a place that watches how you walk.
Yeah, I think so.
And tells you what you need.
So Fleet Feet is one of those people, one of those places, and they could sell him some walking shoes. And hell, I'll write a note for you. If work says you can't wear those, it says you can that you can wear them, just to try it and see if that makes a difference.
Yeah, and a physical therapist, it's great with gait disorders would be a good place.
Yeah.
I tell you, the painful toes and painful feet can really ruin your.
Yeah, because you got to use them every day.
It's awful.
And you don't think about your feet until they start hurting, and then that's all you can think about. And Tacie knows. She said, God, what were those things that you had in your feet that they had? They said that they couldn't take out because if they did, they'd just make them worse. And they weren't Morton's neuromas.
I can't remember what they were called.
It was some weird plantar.
Those cysts she had in. It was right in the middle
and
of the plantar
then they just grew
fascia.
back.
Yeah.
So I'm just leaving them. But they don't hurt anymore.
No, that's good.
Good. Yeah, that's a
I
good
guess
thing.
because it's scar tissue. It's disgusting, though.
Yeah, but it'd be interesting to see if that guy checks if any of the rest of his foot has some deficiencies in color, just in case. But I think a vascular evaluation, podiatrist probably a good.
Well,
start.
your primary care
PCP
dog can do a thing called an ankle brachial index, and all that is they do a blood pressure in your arm, and then they do it in your lower leg, and then they can see if there's a huge difference. Well, you've got a problem with circulation in general. But the fact that this is confined to the two big toes really kind of indicates to me that he may have a problem with his shoes. It may be as simple as that. Go to Fleet Feet or someplace like that can evaluate your gait, see if you've got, you're putting pressure on one side or the other, or just look at your shoes and see if you need a little extra room in there.
Yeah, totally.
Some people wear their shoes till they, till kingdom come, and as we get older, our feet sort of splay out. I do, and their feet sort of splay out a little bit, and they may change, and you may need. But if you go, in the old days, you go to a shoe store, and there'd be a person in there. Oh, may I help you, sir or madam? And they'd measure your feet, and they do this and that, and they'd bring out all these boxes, and you could try things. Now you're kind of on your own in a lot of places, so you want to go someplace where they're actually going to measure your foot and then fit you for a proper shoe. And if you have a bunion, which is just, if your big toe isn't straight, if it points toward the middle of your foot, and there's an angle there at the knuckle of the big toe, which would be, we would call that the metacarpal phalangeal joint. Then you may need to see a podiatrist for this. So I think that's reasonable. Obviously, that's what he was thinking about because he asked us about podiatry.
Yeah. I think podiatry is a good place to go.
All right. So let's take this one. We've got time for another couple of questions, maybe. I think this one's going to take up the rest of our time. Well, let's see.
Hey, Dr. Steve. This is Adam in Nebraska.
Hey, Adam.
I had a question about panic attacks and anxiety. I've had issues with panic attacks, and I've kind of got that put to bed, but now I've got this anxiety kind of worry thing that is a bit of an issue. And I recall in an earlier episode, you had said that you had I think you said anxiety or maybe panic attacks or both.
Yep.
And that you had taken care of it. And I was curious if you would share with us that are dealing with it, how you succeeded.
Yeah.
And maybe I and others could try your approach, or if you have any kind of reference material, books or anything that you think would be good to read.
Okay.
That was that's my question, and look forward to hearing your response. Thanks.
Yeah, thanks, man. Well, he also, if it's the same person, he told me that the square breathing helped him a lot when he has panic attacks. And we've gone over that enough. We could do it again, and it's no big deal. But panic attacks suck.
They do suck.
Fucking terrible.
Because what happens is you have a panic attack when you're flying, so you just stop flying. Then you have a panic attack when you're driving on the interstate, and you quit driving on the interstate. Then
Or
you have
in the rain.
Yep.
And you quit driving in the rain.
And then
That's my deal.
Then you have a panic attack when you're going to the grocery store, so you quit going to the grocery store. And then the next thing you know, you're having a panic attack when you're going out and getting your mail, and now you're stuck in your house. And when it gets that far, it's called agoraphobia. And the panic attacks are so uncomfortable, some people would rather just be confined to their home than to have to deal with those symptoms. The problem is the anxiety doesn't go away. You still have it. And now you're stuck in your home and you still have it. And, it just becomes a routine and it sucks. So the first thing, there's lots of different therapeutic approaches to it. One of them is, and I think your doctor talked to you about this too, Tacie, is what's the worst thing that can happen? They'll jam that into your brain.
Mm-hmm.
What's the worst thing can happen if you go out?
I die?
Yeah.
That's pretty bad.
Exactly.
Yeah, well, you're not going to die. So that's the thing. Well, that's right. That's always what it is.
Yep.
So you go out and you don't die.
Right.
And you didn't die this time, and you didn't die the next time, and you didn't die, and you keep challenging it. When I had the panic syndrome, I don't know what it was. I don't think I'm a particularly strong person, but there was something in me was not going to give in to this panic attack bullshit. And so I went to work every day. I kept going. I went to movies even though it made me intensely uncomfortable. And I went to music events and stuff, even though I knew I was going to pay for it later with severe anxiety. And the day I got cured, basically, or the day my cure started, was at the North Carolina State Fair in Raleigh, North Carolina. And my love for fireworks was overweighed my fear of being in crowds. So I went to the North Carolina State Fair, extremely uncomfortable. And but it had rained for 5 nights, and so they couldn't shoot off fireworks. They always shot off fireworks at the end. Tacie's heard this story a million times. And God, I sounded like Doug Bell just then when I did that. I'm sorry. I'm sorry. Yeah, me and, Jen Aniston, she's heard this story a million times. Anyway, okay, stop. They shot off all the fireworks because it was the last night of the fair, and they had 5 nights worth of fireworks, so they shot them all off. It was awesome. It was really incredibly intense visual and auditory thing, and you could feel it through your whole body and all this stuff, and it was amazing. And then when we left, though, all those people that were there had to go through this little door in the fence to get out of there. And there was at least 10,000 people there, and we couldn't move. And I was like this. I mean, I was like, we were packed together like sardines. I couldn't move. And my thing was crowds. It was crowds. And my wife at the time showed an unusual moment of empathy, and she looked at me and said, "Are you okay?" And I'm like, I have to be. I either am got to die right now or I got to get through this. And I didn't die. And I realized that the worst thing that could happen to me is that I'm uncomfortable. And from that, once that clicked in my head, from then on, it got better and better and better. It didn't go away immediately, but it got better and better and better. And I stopped having the intense, physical symptoms of anxiety and the intense mental symptoms of anxiety. And I still didn't like walking in front of a window if it was light inside and dark outside because I didn't know what was out there. And so that took a while to get over that. And now, yes, like this guy, I'm still a worrier. Tacie knows I just worry about everything, but I'm not it doesn't affect my quality of life like it did. I had no quality of life before that. It came this close to precluding me from getting to go to medical school because I'd gotten in. And I was almost I just was very poorly functional inside here, but outwardly, I still went to my job every day. I was working in a lab with, an immunology lab and sequencing proteins and all that stuff. I did that. I still kept doing everything. And I really think that continuing to challenge whatever it is that gives you the anxiety is the key to that.
Oh, but it's hard to do that when it's things like driving in the rain.
Agreed.
Because it does not rain every day.
Right.
And so it's just like
that's Tacie's thing.
Gives it a chance to build back up in between times.
So for people like that, and like people who have airplane phobia, and there's a term for it, Dr. Scott, you could look that up.
Airplanophobia?
Yeah, fear of flying. There's a name for it. What they'll do is they'll put them in a 3D. It's like one of those 4D environments, or they'll slap an Oculus Go on their face, or an Oculus Quest, or some other Oculus, and simulate it over and over and over again. Because you're right, you don't fly that often unless you're commuting by air.
Aerophobia.
Oh, that's it. I could have probably figured that one out. I'll give myself a boo. All right. But anyway, so yes, and what I want people with anxiety to know is you can beat this. It took cognitive behavioral therapy with me, and continually challenging the beast inside of me, which was the anxiety, and when it was being stimulated, and telling it was full of shit, and that it wasn't going to beat me, and eventually it gave up. The best way I can describe it. But seeing someone that deals with this, psychology, psychiatry, there are medications for this as well, and square breathing, which we've talked about multiple times on the show. If you want me to go over it again, somebody email me and I'll send you a thing on square breathing. But basically, it's just a technique that allows you to break a panic attack, because a lot of times the panic attack is made worse by the physical symptoms of you hyperventilating. So when you hyperventilate, you drive the CO2 in your bloodstream down, and that causes tingling in the fingers, tingling around the mouth. You can get a feeling of tachycardia, have fast heart rate, and of course you're already anxious, so now you're having these physical symptoms, which makes the anxiety worse, which makes the hyperventilation worse. And so you could breathe into a bag, but you look stupid.
Yep.
And if you're on a subway and you're anxious because you got issues with being on the subway, and you pull out a paper bag and start breathing into it, you're going to just put a target on your back.
Yeah, I like big, deep, heavy coughs too. Stimulate the vagus nerve.
I'm okay with that.
Yeah, big, hard coughs.
Yep.
Sometimes they'll kick me out.
Tacie knows that I have an anxiety cough.
Yeah.
Right? Yeah. Remember back when I don't do that anymore. So it gets better and better as time goes on. But I used to have a big, heavy anxiety cough, and she'd say, "God, are you okay?" I'm like, "Oh, no, I'm just anxious."
Yep.
So I figured that one out on my own. My body figured that one out. But I might as well. Shit, I brought it up. Square breathing, it's easy. Breathe in for 4 beats. Hold it for 4 beats. Breathe out for 4 beats and hold it for 4 beats. So it makes a square. And when you do that, you can, if you're only inhaling 1/4 of the time and exhaling 1/4 of the time, you cannot hyperventilate. It's impossible. If you got anything, Dr. Scott, we've got about a minute left.
Nothing, I don't think.
Oh,
well, it's not my damn fault. They'll fire. Hey, real quick.
Well, let's take this from Ramp Salt then.
Okay.
All right, we'll take this one.
Hey, Dr. Steve. This is Ramp Salt.
Hey,
I haven't
Ramp.
got to hear you for a while, and I got to hear you tonight, and I just wanted to tell you how grateful I am that you hooked me up with the Ramp Salt, and that you have such a great radio show. I hate to say this, but I'd probably kiss you on the mouth. You're so good.
Oh, hell, I might let you.
Love you, man. Take care.
Hey, thanks, man.
Cool.
Okay, that was a good way to go out.
Oh, thanks.
Yeah.
Now
Old ramp salt. So look at wvrampsalt.com. I think just Google West Virginia ramp salt. He makes some cool stuff. What is that our son? Is he home?
Yes, it is.
Okay. All right. Well, let's get out of here. You ready?
Let's do it.
Everybody ready?
Yep.
Anything else from the waiting room? Everybody cool?
Everybody's cool.
We'll check in with them before we turn the feed off. Thanks always go to Dr. Scott and Tacie. It was great having you. Got to check us out on our Patreon, where we had Robert Kelly last week and Mark Normand coming up. And we're going to have other people coming in to visit with us in the exam room, which is the...
Did you come up with that?
Yes.
Oh, nice.
Yeah. Well, what it is, because they're asking us questions.
Mm-hmm.
So it's, anyway,
Okay.
it's stupid. It's hacky. I get it. We can't forget Rob Sprance, Bob Kelly, Greg Hughes, Anthony Cumia, Jim Norton, Travis Teft, that Gould girl, Lewis Johnson, Paul Ovcharski, Chowdy 1008, Eric Nagel, the Port Charlotte Whore, the Saratoga Skank, the Florida Floozy, Roland Campos, sister of Chris, Sam Roberts, she who owns Pigs and Snakes, Pat Duffy, Dennis Falcone, Matt Kleinschmidt, Dale Dudley, Holly from the Gulf, Christopher Walken's double, a.k.a. Steve Tucci, the great Rob Bartlett, Vicks Nether Fluids, Cardiff Electric, Casey's Wet T-Shirt, Carl's Deviated Septum, producer Chris, Jenny from the Jingles Department, the inimitable Vincent Paulino, everybody. Eric, Zane, Bernie, and Sid, Martha from Arkansas's Daughter, Ron Bennington, and of course, our dear departed friends, Fez Watley, GVAC, Barry the Blade, who supported this show, never went unappreciated. Listen to our SiriusXM show on the Faction Talk channel, SiriusXM channel 103, Saturdays at 7 p.m. Eastern, Sunday at 6 p.m. Eastern on demand, and other times at Jim McClure's pleasure. And many thanks to our listeners whose voicemail and topic ideas make this job very easy indeed. Go to our website at drsteve.com for schedules, podcasts, and other crap. Until next time, check your stupid nuts for lumps, quit smoking, get off your asses, get some exercise. We'll see you in 1 week for the next edition of Weird Medicine. Thanks.
Goodbye.
Goodbye.
There you go.
Goodbye.
Goodbye. Good day, sir.
This show's over.